Early labor can take a really long time. So what are you supposed to do while you're just like contracting, but not like contracting enough to go to the hospital? What should you even be doing? Today, we're gonna talk about that. I'm Hillary, I'm the pregnancy nurse, and I'm the curly head behind the website Pulling Curls. I am also the creator of the online prenatal class for couples. Here at the Pregnancy Nurse, we aim to prepare couples from bump to bassinet for the confident collaborative delivery that they are looking for. Today we are talking about early labor, which is also called latent labor or prodromal labor, some people call it. And if you're interested in videos like this, be sure and give us a like. And while you're down there, just go ahead and hit subscribe so that you can learn more about your upcoming birth. So there are 4 stages of labor. There is the first one called latent labor. Second one is called active labor, which is when you're actively contracting. That's mostly when people go to the hospital. Third phase is when you're pushing. We'll talk more about that later. And fourth stage, which is the quickest usually, is when the placenta is coming out. So those are the 4 different stages of labor. But today, and actually, I have a video about those 4 stages of labor that I'll link to here. But today we're talking about latent labor, early labor, prodromal labor, just labor that lasts a really long time while you're hanging out at home. So let's talk about that. Now, a lot of people think that once you start contracting, you should just head into the hospital because that's how it happens on the movies, right? But it is really important for you that you stay home. And let's talk a little bit about why you would want to stay home rather than heading into the hospital. When you're at home, you have all of the things that you love right around you. You have your smells, you have your food, you have the TV that you like, you have your area that you like, you have the linens that you like. You just like it and you have a lot of autonomy. In fact, you have all the autonomy. You can make all of the choices when you are at your house. Once you come into the hospital, you have our stiff linens, you have our hard bed, you have us saying, no, we need to monitor the baby for at least 20 minutes before you can get up and walk. The autonomy is decreased. Now, that's not saying that you can't make decisions on your own, you can't have input in your care, but once you come into the hospital, you're kind of giving away a little bit of that autonomy for the safety of the hospital. So that's why you would go into the hospital once you hit active labor. But while you're at home, there's lots of things you can do to make yourself comfortable before you head into the hospital. And for me, I always tried to stay at home as long as I possibly could before heading to the hospital. Now, I also lived very close to the hospitals that I was delivering at, so that was a bonus perk. But if you're living further away, or if you have any questions, definitely talk with your doctor about when you should head into the hospital. That's something that they need to have all the input in because they know about you, they know about traffic, they know about how far away you live, and they're gonna give you a calculation that is most beneficial to you. But while you're at home, what should you be doing? The first thing is to get all of the things done. I remember mentally thinking, you know, I'll just put up those blinds after the baby is born. No, get the blinds in now. Work, get the things done that you can do. Make freezer meals, clean your house, clean your tub, clean your toilets. You're already in labor, so the more you move, the better it is for your body and you can get stuff done. So really try and get your partner involved. I'm not saying you should work alone, but get all the things done that you want to do around the house because when you come home, everything is harder. So just try and get as much done as you can in advance. It's a great way to spend those early labor hours. Another great way is to relax. It's like the polar opposite of what we were talking about. And I would honestly combine both of these. You can take a shower. Showers are my favorite way. Some people take baths. Some doctors are iffy on baths. So check with your provider about what they recommend for you. Getting in and out of the tub at 9 months pregnant when I'm not feeling very comfortable just is not very easy for me personally. So I much prefer the shower. I just drain my hot water tank with warm water running on my back in the shower. It feels so good. And as you relax, that helps your cervix to relax and you can dilate better. If you are spending so much time clenched up and in the fetal position and not talking or breathing, that's not gonna help your cervix open up. So the more things you can do relax the better. Another thing to do is just all the things that you enjoy. If you enjoy cooking, if you enjoy Netflix, you might even wanna save a little something on Netflix that you've been wanting to watch or rewatch for labor because that will give you something to do and something to distract you while you're in pain. Don't negate distraction. It can be a great way to ignore the pain for a while and let your body naturally open up your cervix before you head into the hospital. Another way is to move your body in ways that feel good. I'm a huge fan of turning on my Netflix that I was already excited to watch anyway and doing my sexy hip circles on my yoga ball. That really helps baby find their best way out. It also feels really good, I think, to rotate your hips and to just sit there. I really end up liking the yoga ball when I am in early labor. There are a few weird things that might actually really help you. One of them is sitting on the toilet. That is actually my favorite place to labor because I don't know, it just feels good. And you feel like you have to pee frequently, and I'm always trying to stay very hydrated when I'm in early labor, which is super important because if you're not staying hydrated, you could go into false labor, which is contractions that aren't opening your cervix. And I do not want the pain unless it's getting that baby out. So staying well hydrated. It also helps the nurses more easily put in your IV when you come to the hospital, which I'm a big fan of as well. So I'm staying hydrated. I'm enjoying just sitting on the toilet and, read a book in there. I don't know. It's just my favorite place to labor, so it might be a great place for you to labor as well. One other thing that really helps is for my partner, husband, to massage areas that aren't actually in pain. So a lot of times I don't want him to touch my belly or my back. That does not feel good at all, but sometimes I really like it when he massages my hands or I get one of those scalp massagers. All of those feel good just because other areas in my body are feeling good. It just helps me feel better. And obviously they can massage other areas that feel good. Pressure on your back a lot of times feels really good. And in my online prenatal class for couples, I show you how to use a tennis ball to really massage and make you feel more comfortable while you're in labor. So you don't need a massage license to do these kind of things. It's very easy. One last thing that all the labor nurses kind of talk about is curb walking. Now, we don't have curbs at our house, but find an area that has curbs and you put one leg up on the curb and one leg down. Maybe call somebody that you've been wanting to talk to and just walk along the curb like that and then turn around and do it the other way. It's just that jarring movement of kind of doing this over and over. A lot of times people say that it can really help you go into labor. Kind of weird, but there's something to do also while you're in early labor. Final reminders, early labor can last quite a while. If you feel like you've been in labor for quite a while, I would definitely call your doctor. Maybe they can see you in the office and just check your cervix and see how things are going. That is a lot easier than showing up at the hospital. With a doctor, you can be in and out within a number of minutes, whereas when you come to the hospital, it's going to be closer to hours just because we have to ask you all the questions, et cetera, et cetera. Now, you should never be afraid of going into the hospital. I'm just giving you an option that if your doctor will see you in the office, it's just faster. Of course, labor and delivery is open 24/7, 365 days a year. It's there for you. While you're in latent labor, make sure that you are drinking. We already talked about that. Make sure that you are eating. You're probably not going to want a giant cheeseburger. Maybe you will. Listen to your body, but small snacks that balance carbohydrates and proteins are best. You don't want to fill your body up with carbs and then not have any protein to keep you going. And you don't want just protein because you need those carbs to give you the active sugars that you need right at that time. The last thing to do is to keep moving. Like I said before, it's really natural to just curl up in the fetal position and not want to think about anything or your body or anything else like that. But it is really important that you keep moving. I actually have labor cards. I will put them down in the link of my profile that just give you some ideas of how to move because your brain might lose all those ideas. So a lot of times if your partner can have those cards, they can help you find a position that feels comfortable for you. That way baby can find their way out. One last thing you should definitely be doing is sleeping. When you're sleeping, it's fine if you're not moving, but if you're not asleep, I would consider moving. You're definitely gonna want your rest, so the more you can sleep, the better. You shouldn't feel like you have to keep moving. If you're tired, try and get some rest. So those are the things you can do in early labor. I will 100% admit that it is miserable and confusing and you have no idea when it's gonna end and really sweep you into active labor. That's just how Mother Nature is, but I hope you guys found this video helpful. If you do, give it a like. I really appreciate it and it helps my videos get seen more and it helps you find out more things about your upcoming birth. Speaking of more things, I think you're gonna like these videos that are coming up next.